talked about the beginning of the stage, the raw material, getting that raw material, standardizing it, putting it in a form that can be studied, then figuring out, okay, we know we want to study this patient group. We know we're going to figure out the dosage and intensity of experience. But you brought up a good point, Paul, about the post-treatment, like what happens after. So they've gone through the study, they've taken the compound, and they've had the treatment. How are you measuring afterwards? Are you, I mean, I'm sure there's a battery of questions, you know, are you feeling happier? Do you have any suicidal tendencies or ideations? Is that part of the process too? Is I guess just a questionnaire of sorts to measure the effectiveness?
I'm going to say that this is really a thorough assessment needs to be undertaken. And you're right, Deborah, some of these factors have been studied through self-report questionnaires. And we have a number of dimensions, psychological dimensions that are relevant to ask about subsequent to an experience like this. We're definitely going to first want to probe more so what took place during the experience, because this really is a highly personal one. And the audience may or may not know that oftentimes during the clinical trials of psychedelics like psilocybin, relatively little is expressed on the part of the person having that experience. They may actually be essentially lying in bed with sort of a nighttime eye cover, and for the most part, relatively quiet, not speaking too much. And the guidelines tend to encourage that kind of a situation where they're not probed too much. It's really seen to be potentially intrusive, and rather the therapist is essentially encouraging them to experience whatever they are experiencing and providing some supportive context. But beyond that, in the end, we don't necessarily know too much about what they experienced. So that's going to be part of the assessment. What went on? What did you learn? How did you benefit from this kind of an experience? And then, like you say, in the longer term as well, in the days and weeks, we're going to ask about different experiences that we might expect to be part of the long-term healing of an experience like this. In the research, it's been described openness to experience is one dimension that we can expect. A person might be very closed-minded, ruminative, seeing themselves and others and their life in a very narrow perspective, and now they're sort of opened up and they consider, you know, different perspective, the other side of the argument. They're more able to occupy the other person's shoes in the relationship. And so then they're more sort of fluid and able to adapt and flexible in their perspective. So this openness is something that we might look for. Interestingly, some other dimensions of personality, like even mindfulness. It's been shown that long-term effects of taking in some of these substances include increasing in trait mindfulness. So more self-attuned to your own experience, more able to be receptive to others and sort of noticing and being more empathic about their experience. And so some of these are the positive outcomes. And actually, so far in the research, there really hasn't been significant adverse effects for any of these in any of these trials. But I think that really has to do with the selection of the right patient. And so there would be the expectation of risk factors or contraindications to taking some of these drugs. For example, having prior psychotic episode or psychotic disorders in the family genetically. Some of those essentially are exclusion criteria for these trials. But if we avoid and do a good assessment prior to the trial, then at this point there hasn't been any description so far of any significant adverse effects. And so we shouldn't necessarily expect, as you say, suicidality or anything of the sort. But hopefully we can support the person in the short term. And ideally then in the long term, it's more likely that we might have this increase in openness to experience, increase in mindfulness, and lowering of the problems that they had before, be it depression or PTSD or other mental health issues.
You brought up something that's super interesting where you mentioned, them not wanting to be probed during the experience. In most study trials, if you're taking I don't know, high blood pressure drug, there's so much measuring going on during the trial and during the study. But this type of that makes it even harder to figure out what's going on if the patient isn't saying what's happening and you're not really able to question them as to what's happening.
So this is one of the really exciting things, is that the positive aspects that Paul's describing there, this increase in openness, this increase in possible learning or different perceptions of novel stimuli, these sort of ways of talking about just being more open to life experience that may actually be majorly helpful to patients in these categories. The biology is actually catching up really quickly with the ability to track that in a survey-based manner. And so this is really taking shape as both sort of advanced bioinformatics, the ability to look at gene use and regulation, genotype, and sort of match all of that together. That's getting better year over year and is really likely going to be able to address this question. Similarly, advanced imaging like functional MRI, MEG scanning, these sorts of things are allowing us to actually have a video, if you will, of what's going on in the brain. They're not perfect, but they're a huge step forward from what we had in the past. And so, the potential here has really been highlighted by these, what I like to call kind of macro, person level surveys where we see these effects, we can see the trends in patients, but if we can match that as well with a neuron to neuron and kind of systems understanding upwards, those two are really what's needed to address, questions of, regulatory efficacy, safety, these sorts of things. It's the fact that the two of those are kind of coming together is really exciting to me as a scientist, and then also for this research in general. So
I can imagine that might be kind of an interesting situation if you're down and taking psilocybin and then going in an MRI machine. I don't know.
Some of our advisory board members, that's exactly what they've done with some of their research and shown really, really nice side-by-side results where, patients, especially with severe depression, start looking like in an fMRI, like healthy patients that have never been depressed post-psilocybin. And so it's really illustrative that way.